welcome to another episode on the Medical Pulse podcast. I'm your host, Anish Mohan, and in today's episode, I'm here with Dr. Lou. Doctor, thank you so much for taking the time to join the podcast, and I'm excited to get started.
Oh, thanks for having me on.
Yeah, absolutely. So first, just for me and the audience, please go ahead and tell us a little bit about yourself, what you do in the medical field, and yeah.
Sure. So I have a pretty non-traditional path through medicine. I did pre-med in college, had the intention of doing uh, medicine and becoming a doctor. But I also had a lot of interest in technology, so I studied computer science as a major during undergrad. So I had both of those backgrounds. I then applied to med school, got in, and went to med school. And I went to UPenn, and during that time, I was continuing my interests in technology. So at the time, AI radiology research was booming. There was a lot of new developments in image recognition, and the idea was like, can you use technology to identify, cancer on an X-ray faster than a human could, or better than a human could? So I spent a lot of my extracurricular time in med school focusing on that domain. And for a long time, I thought I was going to become a radiologist. And radiologist is the specialty where you read medical imaging. So it's kind of people call it like a doctor's doctor in the sense that usually they're not the one like directly interfacing with the patient. It's usually maybe like an internal medicine or primary care physician talking to the patient, and then they order the image. The patient goes to go get the image taken, and then a radiologist is somewhere in a dark back room reading the images and then providing the reports to the primary care physician, and then the primary care physician. So I think like already I was kind of in the mindset of uh, practicing medicine in a way that was a little bit removed from patients. Like the research plus like reading images, you're not like directly interfacing with patients. I then did a dual degree. So in a lot of med schools, there's dual degree programs. So some people get Masters of Public Health. I got an MBA. So I decided to learn more about the business side of medicine. It's a huge industry. There's a lot of money moving through the healthcare system. Healthcare bills can be very large, and I'm sure once you become an adult and start having a salary, you'll start seeing like, okay, this is how much money is going towards like Medicare taxes or health insurance premiums. Um, but it's a very complex system as well because uh, money moves through so many different stakeholders. Like you pay the insurance, or actually, rather your employer is often the one paying the insurance company, and then the insurance company has to connect with the hospitals and determine an agreement, and then it becomes very complex very quickly. So I learned about the business side of medicine. And then having that unique background in business, technology, and medicine, I decided to go straight into industry. So that's when I joined Google to work on some of their healthcare products. And I think that's kind of just a trajectory of my path. I was interested in technology, business, and medicine. And this was like the perfect way to bring that all together. Like, how can we use technology to improve healthcare at a large scale rather than like one individual patient, but like improving healthcare overall in the US. So now at Google, I work on AI in health, and uh, there's a number of different projects I work on, but it's a very exciting space, and it changes day by day. And now uh, it's very different from when I started in med school. Like back then, uh, we didn't have like ChatGPT, and people weren't always like looking at their
Yeah.
symptoms. And the same thing with doctors. Like now, doctors have AI scribes, and they use AI tools to look up the latest and greatest advances in medicine research. But yeah, that's my path. It's very non-traditional.
Yeah, I mean, yeah, when you said untraditional, yeah, I mean, yeah. So obviously when people think of becoming a doctor, they think of pre-med, medicine, residency, hospital, right? But obviously
Mm-hmm.
your interests aligned with something different, and that included technology. And now that's how you've ended up here at Google. And
Mm-hmm.
you brought up AI, and that's a big thing I've talked about with other doctors in past episodes is how is the intervention of AI into medicine really affecting the next generation of doctors and patients. And that was more in the hospital setting. So I guess my question for you would be, how are you seeing, as in an industrial point of view, how are you seeing AI start affecting your role and what you're doing when in the interventions of technology and medicine? And is it going in a positive direction or in a negative direction?
Mm-hmm. I would say it feels overall positive to me. I think the most impactful way, I think, is just that people are able to get medical information much more easily. So, before AI, or like if you don't have access to technology, then the way you get medical information is like a short, maybe like 15-minute doctor's appointment once per year. And you get 15 minutes per year to basically ask your health questions. And, that's such a short time for what is probably like, you know, should be the most important like priority in your life is like staying healthy.
Yeah.
Uh, so that is just like such a big gap of like the most important thing in someone's life. And then only having 15 minutes to like really think about that and ask questions about that. And I think now that we have like AI tools, people are able to get that information much more rapidly. You can ask,
Yeah.
at 2 a.m., I woke up, I have night sweats, and I'm coughing. What could possibly
Yeah.
be going on? And then you'll probably get a list of things that some are reasonable, some might not be that reasonable.
Yeah.
But at least you can like start to understand what are the things that are going on, and you can ask follow-up questions like, oh, what is a thyroid? You mentioned like
Yeah.
hyperthyroid could be one of the problems. Let me start learning about the thyroid. And all of this like information about like what a thyroid is like information that's pretty inaccessible. Like there's a reason why like med school takes so long. And, like there's all this information
Yeah.
that is traditionally required to get to the point where you can practice medicine. And I think that is now just a lot more like, freely accessible. And of course, like with the freedom of information, there's like room for misinterpretation or information that's not correct. Uh, and there's certainly like a lot of examples of that. But I think on the whole, people are much more able to take health into their own hands and think about like, what does it mean for me to be healthy? What should I do? As opposed to just like waiting for that once per year doctor's
Yeah.
visit where they
Yeah.
basically uh, don't have much time to tell you what to do.
Yeah. So I like how you talked about taking it into their own hands. So for people watching, when they think of Google, obviously that they might think of the search engine, you know, the Chrome app. So my next question is, as a, a healthcare professional at Google, what will everyday people that use the Google app see from what you're working on? Or what specifically do you work on that has an impact to these everyday people that might not know it?
Mm, yeah. Uh, so I work on the Fitbit team. So Fitbit's the wearable tracker that people can wear to track their
Yeah.
heart rate and so on. I work specifically on bringing medical records into that experience. So a good example might be, let's say you're a typical adult. Uh, you do some activities, maybe like walk up the stairs every so often, but generally you're like driving and you've got a busy
Yeah.
day.
Yeah.
Um, and then for a lot of people, the motivation to be active and to be healthy, like the reason they want to stay active is to be healthy.
Yeah. Yeah.
And uh, it's very common to have medical records or lab abnormalities or medical conditions. So, for example, a large percentage of the American population has um, diabetes or
Yeah.
obesity or high cholesterol. These are like very common chronic conditions that can be improved through activity. So, what I'm trying to do is bring medical records into the fitness and health tracking experience. So you can actually see, okay, in the past 3 months, I was walking 10,000 steps a day, and my cholesterol from 3 months ago was, 100, and now it's gone down to 80. So we
Wow.
really
Okay.
want to connect the uh, like daily activities to the more like medical measurements
Yeah.
that you typically get from a doctor.
Yeah.
And in general, like when you look at your medical records, it's a bunch of numbers. People are
Yeah.
confused. What is LDL? What is HDL? Which one's the good one? Which one's the bad one? Do I want that one to be high or low? There's just like, a billion numbers and
Yeah.
it's hard to understand. So AI is a great tool to help you understand like, okay, what does this lab report mean? And that's what we're trying to do. We're trying to connect the information you get from a medical environment and connect it back to your daily life so that you can understand that like, okay, if I do exercise 150 minutes per week or something, then that actually moves my medical measurements and makes me healthier in a very objective way.
Wow. Okay. So you're not just taking the basic input, which in this case would be how much they're walking. You're combining that with their medical records, their levels, their statistics to then help them be safe and help them determine if what they're doing is making an impact. So
Yeah,
that's,
exactly. We're trying
yeah,
to move from like just pure fitness to
yeah,
really this bigger idea of health.
yeah,
And the way we do that is by bringing in the medical record information, which is
yeah.
really like the most rich source of someone's like medical conditions and their overall health.
Yeah. So that's another interesting, like you said, that the interventions of technology and medicine is a booming business, right? And there's a lot of money and people going into this. And
Mm-hmm.
as someone on the outside thinking about it, it makes a lot of sense because there obviously needs to be a behind the scenes for everything that happens, right? Whether it's just the the platforms on what the doctor uses or just the overall technology that you see in a hospital, there's people behind that. And when it comes to Fitbit, I thought that was a really, really cool example of how there are people behind the scenes working to make that interface or that product medically designed, right? So
Mm-hmm.
I just thought that was really cool. So the second part that I wanted to talk about was, okay, now we have this, but how is this in a modern day impact in hospitals with patients coming in? So, for example, the Fitbit example was someone walking, they can determine if their cholesterol was getting lower. So, is there any examples of how you or others working in these industrial companies are there any products going straight to the hospital? And if it is, what kind of impact are they playing?
Yeah, good question. I would say we don't develop devices like specifically for hospitals. Like Google is really a company that's trying to develop products for the masses.
Yeah, yeah,
That's just kind of like where we play is like a product that you can go to your local, Target or whatever and get a
yeah.
device. I think a good example where there's like a spectrum of like consumer versus more specialized medical grade devices is continuous glucose monitors. So these are things like that you stick on your arm and they can measure your glucose at a very fast interval. Like every 5 minutes, you'll get a glucose
Wow.
number.
Okay.
And typically, like for diabetics, you have to prick your finger and draw blood
Hmm.
and then put it
Yeah.
into a device every time you want to make a measurement. But with this, you can get a reading every 5 minutes automatically.
Wow.
And these devices, there's like consumer versions, like you can walk to a CVS and get one off the shelf.
Hmm.
But then there's also like medical grade versions
Okay. Yeah.
that might be more complex or have more accuracy. Just because like if someone is pre-diabetic versus like has complicated diabetes, their needs might be more intense
Hmm.
and they might need
Yeah.
more accurate monitoring. So I think that's kind of like the same with like Fitbit devices. Like we can measure heart rate. There is like a kg feature that can detect abnormalities like irregular rhythms. But if you're someone with a like serious heart condition, you might have like an implanted pacemaker or something that can also detect these things at a much more precise scale. And it's kind of like uh, F1 car versus like a Toyota Camry. Like one is made
Yeah.
for the masses and one is like very specialized. And Google
Yeah.
as like a large company and the scale it operates, uh, a big part of that mission is to develop things that billions of people can use. So, like, I think that's like one aspect that I like of incorporating technology and medicine in
Yeah.
the way that I've done it is that it's very focused on large scale impact.
Yeah. Yeah.
Whereas there's like, you can become a surgeon and
Yeah.
know the most advanced surgery, and it'll be like a very specialized thing that will have massive impact to like individuals.
Hmm.
So
Yeah.
it's just like I think that's like the a big choice in medicine is like where do you want to have impact? Do you want to have it
Mhm.
at um, you know big impact on a few people, or do you want like a little impact but improve a lot
Yeah.
of people's lives just a little bit?
Yeah. Okay. I found that really, I like that analogy actually, comparing. Okay. So obviously, based on what you said, it's safe to say that your products or whatever you're working on is helping a lot of people. It's a mass product. So like the glucose monitor is something that's really cool because you're able to find it at Target, you're able to pick it up and it's accessible to
Mm-hmm.
almost everyone. Just like a
And
Fitbit.
just to clarify, like we don't make glucose monitors at Google,
Yeah,
but
yeah,
like
yeah.
we partner with companies that make glucose monitors, and
Yeah.
that's an additional signal that can come into
Yeah.
the Fitbit app to track additional health
Yeah.
metrics.
It's cool. Yeah, because obviously you say, for example, you say someone asks you what company you work at. I work at Google. Oh, so you're a doctor? Oh wow, that's even like it's very interesting to like see that face of it compared to doctors that traditional hospitals,
Mm-hmm.
like you said, surgeons, primary care physicians, things like that. So I thought it would just be really great for people to get a different perspective because at the end of the day, not it's not one size fits all, right? Not everyone's going to do the same thing, and the more that people are able to learn about different aspects of medicine, the more they're able to understand, okay, I don't need to go to school for 20 years to just help people, right? So I guess my last question for you would be if you have any advice for students that want to go in your route, they're curious about the intersection of technology and medicine, or just people curious about medicine in general. They want to go through the schooling, they want to end up in a medical, they want to be a medical professional. What would be advice that you have for them or ways to help them along their journey?
Mm-hmm. I mean, I think getting involved is the number one thing. The more like hands-on experience you have doing the thing that you think you're interested in, the more you can validate or
Yeah.
realize that you actually like something different. So like from a technology perspective, it's like pretty easy to get involved. It's possible for people to vibe code health apps and see if that's like an interesting thing, and then you can experience like, is this something that would be helpful for people, and like, do I feel like I can actually make things that are improving the health of people. um, and then on the healthcare side, of course, it's like a little bit more work to uh, find opportunities to like volunteer at a hospital. get a sense of what it's like to
Yeah.
be
Yeah.
uh, seeing a doctor-patient interaction and
Yeah.
understanding where the friction points are. So, like, I
Yeah.
think by getting involved, you just start to see like, oh, these are the interesting problems that I'd
Hmm.
like to work
Hmm.
on, and then that helps like clarify
Yeah.
what kind of path that you want to take. So, like, like even in med school, you have to go through all these rotations. You rotate
Yeah.
through like psychiatry, inpatient hospital, surgery. And then through that experience, that's where a lot of people start to understand, like, okay, I like this, I don't like this, therefore I want
Mm.
to become a surgeon. And I think the earlier you have that exposure, the more clarifying it is, and the better prepared you'll be able to like know where the destination is, so you can figure out like the best route to get to that destination.
Yeah. Okay.
Yeah.
Thank you. And that was good advice. I mean, especially if you don't know where, like a lot of people go into med school not knowing what they want to do. And I think that at the end of the day, just picking something that you like over anything is so I like experience over anything. Yeah, it's pretty cool. Doctor, I want to thank you so much for taking the time to join the show. I'm sure the advice you gave would help a lot, especially because it was very unique and it was very untraditional. I appreciate the advice you shared on your aspect of a healthcare professional and a doctor. So I want to thank you again for joining the show, and I hope to have you sometime later in the future.
Thanks for having me. It's a great
Yeah, no
conversation.
problem. Thank you. I appreciate it.
All right. Take care.